Welcome back to my YouTube channel, and today we're doing what we call First Aid Level 1. Very important because it will help you understand the basic importance of this training. So this training is actually based on the unit standard 116534 NQF Level 3, which is actually worth true credits. So this training will actually, help you with the knowledge and as well as with the skills, and imagine with confidence as well, to walk into the scene and be able to carry out the basic first aid treatment. In the workplace, it could be on the street as you're walking, maybe on the street, and you see someone collapsed, or you can be anywhere, right? But you will be able to perform your first aid. So very important, guys. So with this training, the reason why we're doing this, it is also aligned with Occupational Health and Safety Act 85 of 1993. So specifically what we call General Safety Regulation. So remember, before we talked about 4 categories of regulation, right? So first aid, we can say it falls under what we call general. So General Safety Regulation, Section 3, subsection 4, which actually requires every employer to actually what? To provide first aid equipment. To what? To as well do the first aid boxes and as well trained first aiders. So depending on the number of employees and the risk in the workplaces, let's get started so we can understand, the background of this first aid level 1. So I always start with legislation, right? So that you can understand the legislation and background, right? So in South Africa, first aid is supported by what we call 3 important acts, which I refer to as South African Qualification Authority, which is SAQA. So this was actually established in terms of Act 85 of 1995. I mean Act 58, not 85. Act 58 of 1995. That is SAQA on its own, right? So SAQA manages the National Qualification Framework, NQF, those NQF that you see, right? Because the NQF actually organizes and classifies qualifications and competencies in South Africa across 8 levels of learning. So it's very important because with this training, first aid level 1 is at NQF level 3. So these are the things that you need to know that will also help you. And before I start my teachings or lecture classes, I always want you guys to understand the purpose, right? The outcomes. How are you going to benefit, or what are you going to benefit at the end of this course? Why are you doing it, right? So the purpose of this unit standard is for people who are actually responsible for applying first aid in the workplaces. So because now you are working with different people who are working in hazardous or sometimes a workplace that needs you to actually understand the first aid so that you can be able to be your brother's keeper. So by the end of this course, you guys will be able to actually know how to describe first aid equipment, and you will also as well be able to explain the application, because it's very important how to do it, the application, right? Applying it. So, and you will as well be able to access the accident scene. You'll be able to report and make it safe, because imagine now you know how to do it, the confidence of it, right? You know that you can save a life. And you as well need to know how to prioritize casualties and treat them, because that's very important. So the specific outcomes are described in the first aid equipment and procedures. So number 2 is that we're going to access this accident scene. Let's say now you see an accident there, you'll be able to access the accident scene because now you're a first aid level 1 and you're qualified, right? So you're going to as well prioritize casualties and as well be able to treat them. So now let's get deep into it. Let's look at what I call the chain of survival. There are actually 4 links in the chain of survival. And number 1, I refer to it as early access. You know, early access, right? And number 2 is what I refer to as early CPR. Because remember, for every minute, you guys, that you are not actually performing CPR, 10% of the patient's brain actually dies. So imagine now you leave someone there waiting for an ambulance. 10% of their brain dies while you're not performing that CPR. And if you know and listening to all this that I'm teaching you, you'll be able to save that person before it even gets to hospital. And number 3 is what I call early AED or defibrillation. And number 4 is what I call advanced life support. You can only leave a patient once the ambulance arrives. You know, now let's say if someone fell there, you can't leave them. You have to be there, even if they say, no, don't help me. You have to be there until helps arrive. But if you see that the situation is getting worse, like someone is maybe burning in the car, or for example, you just have to help them, because now it's either to save someone's life rather than just letting them die. A person might rather die with, their ribs broken, than just saying, oh, I can't save them. I don't want to break their ribs. You rather break those ribs if, you need to preserve what you call life. So there are 3 principles of first aid, which are called preserve life. For example, CPR, if their heart stops, that's when you perform CPR. Why are you doing that? You're preventing the condition from becoming worse. That's number 2. It's the principle, right? First, the reason why it's aligned like this is because preserving life is the first priority that we do, right? And then that's when number 2, we can actually prevent the condition from worsening. And how do we prevent the situation from becoming worse? We stabilize the patient. So if there is bleeding, we make sure that we stop the bleeding. And number 3 is that we promote recovery, right? How are we actually making sure that we are promoting recovery? By actually keeping, the patient, or keeping them alive, and as comfortable as possible, because we can only do that until help arrives. Reassure them, you're going to be fine, ma'am, you're going to be fine, don't worry, the ambulance is on the way. You see, reassure them, give them that hope, you see. And on this chapter as well, I want us to look at the dressing and bandages. Remember, as a first aider, you're gonna have your first aid kit. You see, that kit, you need to know how, what's in there and how to use it. So those dressing are what we call protective coverings. Some are used to treat wounds, some are used to control it, some are used to stop the bleeding, and as well prevent infection. So what do we use dressing for? Because dressing should actually be as clean, as sterile as possible. You make sure that it's clean, guys. You can't apply any dirty dressing, right? Be able to cover wounds, because sometimes you're gonna meet people who are bent, you see, and you must as well make sure that it's thick and soft, so that you can actually handle the bleeding, and as well make sure you apply the pressure. I'm going to show you how on the practical that we're going to do. So we're going to as well lint free and non-stick, such as gauze, or the cotton. So guys, make sure that if you want to start the classes and do the trainings, visit our website at Divine Consultation Group, www.co.za. So sometimes you might not have the dressings. What are you going to use? You can use sanitary pads. You can improvise, right? You can use plastic wraps, and on some that you don't have, you can use a clean cloth. So apply if the dressing, you can apply the dressing if you wear the gloves, and you wash your hands before and after. You extend the dressing beyond wound edges. So if blood soak, let's say blood soak off, soak through, let's say it's too wet, apply another, don't remove that one. don't remove that layer, you add more layers, right? Secure with tape if, let's say, for example, you don't have anything to secure with, or you can use bandages, right? So bandages, they help with holding the dressing so that you can apply pressure or support the limbs. So they may be actually improvised, with the belts sometimes, or the ties, or even the scarf. So everything that you need to do, because sometimes you might be helping someone, but you find that you don't have those equipment. What can you do? You need to improvise. So there are types of bandages that include head bandages or triangular cloth that actually tied around the forehead. And we have what we call knee and elbow bandages, which actually wraps across the joints. And we have what we call hand and foot bandages. Those are actually triangular fold that is actually secured at your ankle, right? And we have the roller bandages, which as well secure the spiral wrapping of the limbs. And we have what we call slings. So with the slings, they're actually supporting the arms and improvised with scarves, belts, or jackets. So now let's jump off to most important thing. What do you do, guys, when you arrive to a scene? Let's say if someone collapsed there on the road, what do you first do when you get there? So very interesting, and you're going to love it. So the primary survey and what we call CPR. So Triple H SCAP. I call it Triple H SCAP because when you arrive at the emergency, you always do a primary survey, which is that Triple H SCAP, right? It's more like Triple H and then SCAB. So you check for hazards. Is the area safe for me to actually approach or help the patient? Right? Now you've saved is safe. Then you're great. Make sure you check if the patient can respond to you. How do you do that? You tap them on the shoulder and you talk to them. Hello, ma'am, are you okay? With the loud voice so that they can hear you, right? And then if they're not responding, you call 082-911 in South Africa, which is the ambulance, right? Or EMS. You tell them exactly what is wrong. For example, the patient has an open fracture, so bring a first aid kit if, let's say, for example, let's say that there's no sign of life, right? You start listening for breathing. So with the signs of life, how do we actually check the signs of life, right? First of all, how to do that? We scan the chest, right? This is how we scan the chest for 5 to 10 seconds. And we listen closely so that we can hear if our patient is breathing or not. We as well check the pulse. Then that's when we can start with our compression if there's no signs of aliveness. So we begin with the chest compression. So just below this rib cage. So that's where we're going to place our hand, both of our hands there, and we start pumping. Then after that, after doing for 30, we as well open the airway. How do we do that? We just touch the patient on the forehead and on the chin, and we take it like this so that if there's any blockage here, at least they can breathe, so we can hear if they're breathing. If not, then that's when we go again for another 30 compression, and we start giving them 2 breaths, right? 2 breaths. How do we do that? Mouth against the mouth so that there's no air that is coming out. So make sure it's secure, and you close their nose like this. Remember, guys, you can only leave the scene if the patient is better. What do I mean by that? If the patient starts breathing, B stands for breathing, right? And if there is energy or AED that actually takes over on the chest, that's E. And as well, if you are too tired, because sometimes you're busy breathing there, but you are too tired, at least stop 2 minutes and then save your breath and save yourself. Then be able to repeat it again. And then the last one is A, when the ambulance arrives. So now let's look at the secondary survey, because now once the patient is stable, right, we perform what we call secondary survey. Let's say if the patient starts breathing now, what do? We jump onto secondary survey, where we actually treat for shock or for major bleeding. We check the bleeding, like if there is anything that is wrong with the patient. We check the bleeding from head to toe. We check those injuries, if there's any injuries, right? Then if there's no, we jump on to what we call sample. You see the history to see how the patient, what happened to the patient. So how do we do that? S stands for signs and symptoms. We check signs is, remember, something that you can see, and the symptoms is how our patient is feeling, right? We ask them questions. Then with allergies as well, we ask them, do you have any allergies? Medication, are you taking any medication? Past history, you see, the last meal or the event, what did you eat, where? You see, we check all those vital signs. And as well, that's when we can jump to level of consciousness, LOC. So how do we do that? Pupils, right? That pale pupils, equal and reactive to light. We check it with the light. We check the breathing as well, number 2, where we, 12 to 20 breaths per minute in adult. They should be able to do that. How is the breathing? Is it fast or slow? We check the skin, right? Whether it's wet, it's hot, or it's cold, it's pale, it's blue, it's red, yellow, or gray. We check those things to make sure that our patient is okay. Then we jump onto the heartbeat. You see, carotid pulse, if it's unresponsive, or radial pulse, if it's awake, because it should be 60 to 100 beating per minute in adults. So those are the things that we actually check for. Then once that is done, then we treat for shock. We check the shock, because sometimes the patient might be shocked, right? So shock is when the organs don't actually get enough blood or oxygen. They don't get enough blood and oxygen at the same time, you see. So the causes include failure of the heart. So that's when we can, remember, heart is a pump, right? It pumps the blood, and those blood, it's more like fluids, all right? And we have what we call vessels. Those are pipes. So blood takes the fluids through the pipes, right? So now let's look at the signs. Is the patient confused, dizzy, fast breathing, cold or clammy skin, fast heart rate, nausea? Is he vomiting? So we check those things, because those are the ones of the symptoms. That's when we can as well jump into treating the patient. You put them in a recovery position. So I'm going to show you how on the next video, because if their spinal joint is broken, so you need to make sure that you leave them well, right? If there's no one to help with, do lock roll, because now that spinal injury is suspected, right? So never give them food, guys. Don't give patient food or drink. We are trying to treat something here. So what if that food makes them worse, or water makes them worse? We don't give them water and or anything, right? Because there are common emergencies that can as well happen. We have asthmas, where people have fatigue, you see. So the treatment is you put them in upfront positions, and you use inhaler or steam, because their asthma is dry, right? And you call for ambulance if there's no improvement, because you find that so at least steam will actually make them better. So, and then we have what we call choking. So signs of choking is when the universal gesture here, let's say for example the patient is like this, and then there's a lot of veins here, you see. If it's choking, we do what we call Heimlich maneuver. So where you place 2 hands here, and then you stand behind them and you try to take that thing out, right? Then we can as well do CPR. So there's as well heart attack, where someone maybe has chest pains on the left arm or on the neck, you see, and their skin is pale or green or gray, sorry, and then their skin maybe sometimes sweating, or they feel nausea. So call ambulance immediately and put them in semi-seated position, because now they have a pain, right? CPR if no heartbeat, because sometimes we have to actually perform CPR if we can't see the pulse. And make sure you keep calm, right? Let's say if someone now faints So you find that the signs are dizziness, their skin as well. You see, so you start treating them. Put the blanket on top of them. Make sure that you move if the spinal, you don't move them if there's spinal injury, and also ask about their last meal, right? So, and seizures. Oh, seizures are very difficult, and that's where the body just, move in a certain way. Stiff body, uncontrolled shaking. You see, those are the signs. So you call for help immediately, and don't restrain the patient. You see, make sure that you protect them from injury. So don't put anything on their mouth, because sometimes they'll be shocking. You see, maybe you try to put them in airways. Open their airways, and as well put them in recovery position. So unconsciousness. When someone is unconscious, signs, you find that there's no response to pain. There's no pain response. And the treatment, primary and secondary survey, that's when we treat visible injuries, right? So now the bleeding, when someone has excess bleeding, it could be external or internal. So with external, we put the direct pressure and elevate the limb. And internal, we do not move the patient, right? We call for ambulance, because imagine if you can make things worse inside. And impelled objects. You see, for example, maybe there's a knife or a glass. So the treatment is that do not pull out. You see, pad around, bandage, treat for shock, because that one, it has different, thing. So now let's look at the burns, right? Burns, remember, there's a first degree epidermis, and that's the first level of burn, and there's what you call second degrees, which is dermis, and we've got the third degree, which is called subcutaneous. So the types is dry, wet, cold, electrical, chemical, radiation. So you never use ice, butter, or toothpaste, or creams, or oils, or eggs, or sand, or coffee, or spirit. Because I know you guys, your grandmother will tell you, oh no, I have experience with this, just put Colgate. No, you don't do that, guys. You use the cool running water and clean the covering, right? And then we have what we call hypothermia, where let's say maybe the body temperature is above 38 to 40 degrees Celsius. So that is high risk of death, you see. So the treatment, it's cool gradually, and we call for ambulance. So with hypothermia, that's when you find that the body temperature is below 35.5 degrees. And the causes is that you find that they're extremely cold, wet clothing, and because now it's just wet, right? And wind as well. So treatment is that warm slowly, remove the wet clothes, and those blankets, if there's blankets, and as well as the shelter. So, and other equipment, let's say with hypothermia, someone has fell inside the eyes, for example, you see. So that's when you can actually start doing that. So other equipment is that we have what we call extra items in the first aid kit. That may include trauma shears for clothing, you see that thing where they put a patient, you find that, let's say for example, now you're at the street, right, and you see a patient covered with that gray sheet, and you think, oh my god, he's dead. No, that sheet actually has two ways. There's what we call hypothermia and hypothermia. The side where it's cold and the side where it has actually some heat. Because now, if you're unconscious in this generation, they can take you through a mortuary, and when you get to the mortuary, obviously there's no chance of getting out, because those people are running business that might kill you. And you find that these younger ones now, the families these days, they've registered you for what you call those claimings, policies and whatnot. So because they want you dead, then that's when they can claim 2 million or 3 million and become rich, you see. So anyway, let's continue. We have what you call alcohol pads for skins and tools, irrigation syringe, which are used for wound cleaning. remember we said a torch of a flashlight is to see if the patient can respond to that light. See? So, and we have what we call instant cold packs, the hand sanitizers as well, antiseptic wipes. So very, very important for you to usually understand. So guys, don't forget to go and visit our website at Divine Consultation Group, so that you guys can actually go and see what courses you can take and get certificate and be approved and start working if you have to. If you are a big company, your employer, you want us to do supervision at your workplace, do the filing and everything, make sure you call us. So guys, the last section, so finally the personal protective equipment, PPE. Remember, PPE protects you guys. So the first aiders, it can protect you from infection, because let's say you're wearing those gloves at work, or your mask and so whatnot, you see. So this includes disposal gloves, your goggles or protective glasses, surgical or N95 mask, right? And sometimes for patient, even aprons, because sometimes you're going to deal with a lot of bleeding, and which infection can actually get you if there's too much bleeding, you know. So make sure you protect yourself. So always use what we call PPE. So PPE is when possible, because now I always use it when possible, because your safety as well comes first, right? And that concludes the complete first aid level 1 training. So we're going to have part 2 where we do practicals, and I show you how to do Heimlich maneuver, you know, how to do the CPR, how to do you know, the recovery position and lock roll, all of those things. So remember the key points, 3 P's. We preserve life, we prevent worsening, and we promote recovery. So, and remember the primary survey that we talked about, 888 SCAP, where we say when we get into the scene, we check for hazards and we talk to the patient and try to see if there is any response. Hello ma'am, are you okay? Then we call for ambulance, then we check the signs of life, and that's when we can go for compression. Then we open airway and we check the breathing as well. So the beta rule is that we only leave the patient when the patient is better. So that's when we can stop the CPR, right? And if the patient wakes up, that's when we can do what? Secondary survey, which we call sample, for full patient assessment to see, you know, what did they eat last time, what are the allergies, medical records, and all that. So, and finally, we talked about protect yourself, right? The PPE, we did explain them. So with this course, it's actually aligned with Occupational Health and Safety Act 85 of 1993. So the General Safety Regulation, Section 3, Subsection 4, which actually makes first aiders and first aid kits a legal requirement at work. So if you found this training valuable, click like, you share with your colleagues, and make sure that you subscribe for more you know, workplace health videos. And remember, this safety training is here to help you, and safety begins